Hello, ma'am. Is it audible?
Audible, madam.
Okay. Good afternoon, all. Myself, Dr. Aisha Mulla, welcome you all for today's session of online webinar Pratigya 2020. Today's speaker is Dr. Shwetha.D. Shwetha ma'am is going to speak on the topic of specific feeding schedule, Stanya Sampat, Stanyotpatti, Stanya Sanghatana. Dr. Shwetha madam has completed UG from Sri Dhanvantari Ayurveda Medical College, Siddhapur, and PG from Sri Dharmasthala Manjunatheshwar College of Ayurveda and Hospital, Hassan. Madam is presently working as Associate Professor in Amrita Ayurveda Medical College, Chitradurga. Madam has given talk for ASHA workers and other health workers for the government training programs regarding the home remedies, and madam has given the talk as Poshakarigondu Suchane for parents of school going children at Davangere in a school activity. Madam has participated in various health checkups, and madam has presented post presentation in World Ayurveda event. Madam has presented many articles in newspaper and magazines. I welcome you, ma'am. I request Dr. Shwetha ma'am to continue the session.
Thank you, Dr. Aisha.
Thank you.
Good afternoon, everybody. So again, before the topic, so I would like to thank. Again, I feel it is a humble part of giving thanks. That is Ayurveda Mahavidyalaya Hubballi and the principal, and also the Department of Hormonal, that is the organizing committee of Pratigya, that is Dr. Shwetha.D. So again, it is I thank everyone to make me to participate in the Pratigya, a unique event. So that is exam-oriented syllabus-based Hormonal symposium. So especially for the undergraduates. Okay? So I like, and also that I want to thank my our principal, Dr. Shwetha.D. So that is again for the non-stop encouraging us for such activities, So again, he's been always supporting us for the various activities and all. So again, Amrita is the medical college principal, sir. And again, without delay, so we'll move on to the Stanya Prakarana. So again, this being a unique concept, so it is again very important to know all the physiological and also the aspects of the Stanya with respect to the breast milk. And we usually got the various range of issues relating to the breastfeeding. It may be the normalcy or it may be the abnormality. Okay, so again, it is being a specificity. So again, it is very necessary to know all regarding the normal aspects of the Stanya as well as the pathological aspects of the Stanya, again, or the breastfeeding. Okay, so again, today, so with this aspect, so again, I'm going to take a few topics regarding the Stanya Prakarana. So again, yesterday, that is again, Dr. Adita madam, so with some of the aspects. So again, with respect to that, so again, also today I'm going to see some of the aspects, that is like introduction to Stanya Prakarana. So again, Stanya Sampat, properties of normal breast milk, and also Stanyotpatti, that is the physiology of lactation. And the Stanya Sanghatana, that is the composition of the breast milk, and it's a very important and specific schedule feeding schedule as per Ayurvedic text and the modern one. Okay, so these are the few aspects today I'm going to take in this class. So again, it is like so again coming for the introduction. So the human body always grows that's by food. Okay, so that is again so rightly with respect to that, Kashyapa says that so nacha ahara samam kinchit deshajam deshajam upalabhyate shakyate apyanna matrena naraha kartu niramaya. That is he says that the so there is no medicine like food. Okay, so that is nacha ahara samam kinchit deshajam upalabhyate. That is the वैशिष्ट्यम उपलभ्यते so shakyate apyanna matrena naraha kartu niramaya. That is undoubtedly so this food is acts as that is that attains the disease free state of the body. Okay, so that is that. So with that food is life giving and life saving, we can say that. Okay, so that we all know that in utero garbha poshana is done by placenta, but after birth the baby is to be fed and taken care. Okay, so that with respect to that, so again hence the in Komaram the definition to give the importance for the feeding aspects of the child, that is the Stanya Shira and the Dushta Stanya aspect and all that is and its treatment. Okay. So again most of the authors also mentioned again age classification, that is the Vayo Vibhajana based on the nature of food taken by the child or the baby. So here this shows that so again what are the Poshanartha. So that's again whatever the food taken or the fed the baby or the child is a very important factor as it is a food is life saving or the life saving. Okay, so that is again Ayurveda, that is the Kshirapa, Kshiranada, Annada. That is the like with respect to that in the Kshirapa Avastha where the for portion of the Shishu is mainly depend on mother's milk, that is the Stanya. Okay, so again we get it very elaborately that's again mentioned in our classes regarding the Stanya. Okay, so again even in the contemporary review also again it is a being like a big platform for them to as a for the research work and also according to our whatever the aspects mentioned in our classes also it is again being a platform for like more researchers to say research phase. Okay. So this is regarding the sannyas, as I told, so it is elaborately like explained in our classes too. So the Kashyapa, so gives the simile regarding the importance of sanya, like to the child. He says that so that is the yatha sarvaushati saram shrirode matite pura sambhutam amritam divyam amara ena devataha. So that is the so again तथा सर्वौषधि सारं गवादीनां तु कुक्षिषु क्षीरम् उत्पद्यते तस्मात् कारणाद् अमृतोपमम् जरायुजानां भूतानां विशेषेण तु जीवनम्. That is the it says that so in those days so how the devatas become immortal, that is amara by like consuming that amruta, that is called as a sarvaushadhi saram, that is again whatever the sara will come in the samudra mantana shirode madhitepura. So that becomes immortal. Similarly, whatever the Gavadi Namchu Kukshisha, that is in the so body of the Gavadi animal, the again that is whatever the Sara will come as a Sara that come in the body that is Kshira, that becomes the Amrutokamam, that is become a Prana for the Amrita for the for their offspring. And especially they say that a Jarayujana Bhutanam, that is again those who are taken birth from Jarayu, that is the placenta, that is again a human also, that is Visheshena to Jivanam. So for them it is like become life Jivanam. Kshiram Satmam Ji Balanam Kshiram Jivanam Uchate. So it is a that Kshira is a Satma to the Balaka or the Bala, and also it gives the life for them. Okay, so this is the again it's very important. So that is again there everybody. So like Bala life. Okay, so that is again regarding the introductory part. So again coming to the contemporary view. So they also explain so similar way, that is the breast milk or the mother's milk is a milk produced by mammary gland located in the breast of a human female to feed a child. That is again a milk is the primary source of nutrition for newborns before they are able to eat and digest other foods. So according to the WHO and IAP, so breastfeeding is a normal way of providing young infants with the nutrients they need for healthy growth, healthy growth and development. So again, with this introduction, we'll move on to the important topics that is the so again like Stanya Sampat, that is the properties of normal breastfeeding or the ideal breastfeeding. Okay. So again regarding to this, so we get a various like in all the most of the Pranatra use, they explain their view regarding the Stanya Sampat. So according to the Charakacharya, what he explained is Stanya Sampattu Prakriti Varna Gandha Sparsham Udaka Patrecha Tujamana Mudakam Veti Veti Prakriti Bhutatva Tat Pushtikaram Arogyakaram Chayati. So that is again so it like ideal breast milk should contain all these Prakruta Bhava of all these Prakriti Varna Prakruta Varna, sorry. So Gandha, Prakruta, Gandha, Rasa, that is again other acharyas they told regarding the Varna, Gandha, and that can be taken here. And that is again Prakruta Varna is nothing but the Shishta says that the Shankhava Basam and also Vasudeva is the Pandura. So that is again Prakruta Varna. So Shankhava Basam is the Pandura, so is the Prakruta Varna. So ideal breast milk should contain all these factors. That is the Rasa, Mudura Rasa, Kashaya Mudura, and Gandha, Mudura Gandha, Sparsha, Himavat, or the Shita, that is Shita Sparsha, Himavat, that is that lightness you can consider Sparsha, and it forms a homogeneous mixture with the water. Udaka Patrisha, Dujya Mana Mudakam, Kesi Prakriti Bhutatva, it becomes a, like mixes with the Jala Bhuta, so evenly. That is again that Pushtikaram, Arogyakaram Chayati. That is it gives like Poshana to the Pushtikarata, and also it becomes Arogyakaram for the child. So these are the like Stanya Sampat Lakshana. So it's again coming to the other properties. So again we get the in the different context we get the some of the references regarding the Stanya, that is the with respect to the Pramana. So we get the like that is the Pramana of the Anjali, we get the reference. So that is the Guna, Laghu Guna, and Virya Shita Virya, Vipaka, Mudra Vipaka, and that is these are the properties. And according to Kashyapa, so he gives his view has a Apyahata Balangayu, Arogo Vardate Sukam, Shisho Dakyorana Patihi, Shuddha Kshirasya Lakshanam. So Kashyapacharya, he mentioned that, so in the Tilastana, so Apyahata Balangayu, that is the unimpaired Bala, Anga, that is the body part, and Ayu, and Vardate, that is with respect to growth and development, Sukram, that is the comfortable state. So for both child and the mother, these are the features of the ideal or the pure breast milk. Okay, so these are again we can like observe that. So whatever the other like other that is the other acharyas what I mentioned. So that is these are the few related references regarding the Stanya, that is Stanya like Lakshana or otherwise useful in different like even different situation also. So again, that is if you see the Stanya Sampat which is explained by other acharyas, so that is the even they mentioned that so only the like physical properties of the Stanya as well as its effect on the child. So whereas we can observe in the Kashyapa's acharya's explanation that so even he also like mentioned like whatever the outcomes or the benefits or the that is again the features will be seen even in the Shishu as well as the Dhati also. That is, he also includes that. So that is the lactation is very important even for the feeding mother with a view of their health. Okay, so the Dhati or Anapati Shuddha Shirasa Lakshana. So there is he mentioned that unimpaired attainment of the Bala, Anga, Ayu, and Varta, and also Sukha, even in both the mother and the child. So it is seen, so it indicates that it is the feature of ideal breast milk. That is the Stanya Sampat. Okay. So that is these are the Kashyap's view. And apart from that, we get the various references. So that is again treatmental utility of this breast milk in the various diseases. That is the so in the Shushruta Samhita, we get the Naryastu Madaram Stanyam, Kashayanu Rasam Dhimam, Siddham Sairekaram Sheetam, Chakshusham Balavardam. That is the Chakshushya. That is again so it is attached as a Chakshushya and Jivanam Brahmanam Satnam Stehanam Manasham Payava. So again, we all know that Jivana Brahmana is also Satya for the child Stehanam. And in the next line is the Navanam Ratta Pittecha, Tarpanam Cha Akshishunam. So that is here the so again it is also used in the treatment different treatment modalities, that is the Navana Nasya. So in the case of Ratta Pitta can use as a Navana Nasya, and also this Stanya can be used as a Tarpanata in Akshishunam. So again so in the Ashtanga Arudaya, so I explain that too in the various Akshi Rogas, that is the Manasham Vata Pitta Abhigata Akshi Roga. That is again so Vata Pitta and also Abhigata, that is Akshi Roga, due to all these factors. So especially in the eye disorders, this can be used. So that is a Manasha Paya. That is a breast milk can be used in different modalities, and also in various conditions also. So it is again so this is regarding the Stanya Sampat, and also again it's a very important Stanya Sampat is being asked for the exams for the 5 marks. This is the repeatedly or the most expected questions, and also in the various question papers this also includes Stanya Sampat, and Charakacharya also explained. So that is some of the physical aspects of the Stana, that is which comprising the formation of the that is anatomical structures, or otherwise we can take it as a dhatu, so it's comprising the stana or the any anatomical structures. So that is whatever the help for the further lactation. So that is if proper dhatu attains such lactating mother, so then that lead to the so that results in a efficient lactation. So that is with respect to that, or with giving to that, so Stana Sampat also is again been explained by our acharyas. That is a Tatrayam Stana Sampat, Na Ati Urdhvam, Na Ati Lambavan, Na Ati Kushavan, Na Ati Pino, Yukta Pipalaka, Sutta Prapan Naucha Iti. So that is so he says that Stanya should not be Na Ati Urdhvam, that is it should not be Ati Urdhva, that is too much. So facing upward, you can take it, or too much erect. So Ati Lamba, Na Ati Lamba, that is not too long. Na Ati Tina, that is excessive corpulent, we can take this as pendulant. So again, lads we can be taken. And also Ati Kusha, it should not be not too emaciated condition. And Yukta Pipalaka, that is Pipalaka. So again, nipple can be taken. So it is as a nipple. So appropriate nipple should be there. So again, Sutta Prapan now, that is comfortable for sucking with the Yukta Pipalaka. So that is again proper latching will be established with the proper nipple form. Okay, so that is so these are the Stana Sampat. That is it says that the outcomes of the so what happens if these the conditions will be there in the feeding mother. That is the Urdhva Karala Kuriyat. So that is the Urdhva Sani. So again due to of too much facing upward, so baby wants to face continuously upward for during the feeding. So hence it may lead to the so Karala Danta or the Rupa, that is again Karala Danta it may be taken. So or otherwise some make the baby may feel the difficulty while feeding, and also make the different phases at the time of feeding and also so that is the Karala Kuriya Lamba Sani Nasika Muga Chadayitva Maranam Apadaye. That is the Lamba Sani. If it is too elongated, so then there is a chance of getting a so blocking of those mukha and nasa, and that Chadayiti, that is a chances of getting blocked by these two, so nasa and mukha. So that may lead to the apnea like conditions, and the Maranam Apadaye, that is that may lead to the so that is Marana. That is so this is the outcome of improper stana. That is so Sampat also. It's again in the previous class we get the we got the question regarding the 2 marks. So we got for the 2 marks and the 5 marks. Okay, so again this is the Stanya Sampat. So go through that. So coming for the next topic, topic, that is the Stanyotpatti. So that is this Utpatti, that is the physiology of the lactation. That is whatever the physiological aspect regarding the lactation. So like even we got the very brief explanation. So that is like elaborately explained. So that is again with respect to Stanyotpatti, we got the reference. We'll see the reference under the different like aspects of the nirmana and the pravritti. Okay, so that is the coming for the nirmana. So that is nirmana. It is nothing but the production of the breast milk. Okay, so again this is the regarding the production. So we got the reference like Rata Prasada Mudaraha Pakva Ahara Niruttajaha Krishna Reha Stano Prapta Stanya Nityavidi. So again we all know that. So this is the Stanya is the Upadatu of Rasadatu. So how it is formed is that so Rata Prasada Mudaraha. That is the so Madura Bhaga of the Sara Bhaga, Madura Sara Bhaga of the Rasadatu. So it is going to the so again Pakvahara Niruttajaha. So this of Vaishna Tattva, like it again, and also Krishna Reha, it circulates all over the body, and Stano Praptaha, when it reaches the Stana, then Stanya is so it's converted as a Stanya. So again, we all know these references, and again, so it's again, we got Kashyapacharya's reference, that is also again beautifully explained, that is so Kashyapa in the first chapter, Sutrasthana, so he says that this context while explaining the prakriti in the prakriti formation in the fetus. Okay, so this is what he explained is so even in the before the delivery, if the lactating pattern or the lactation, so that is again whatever the physiological aspects of the milk production and the ejection, that is the process is being going on. That is he says that so whatever the ahara is taken by the garbhini, so that is again that is divided into 3 types. That is the Yadana Panam Prayena, Garbhini Sri Nishevate, so Raso Nivrutate, Tadru Tridha Cha Asya Pravartate. That is the Tridha, that is divided into so that whatever the aharas are, it is whatever expressed from the ahara which is taken with the Garbhini, so it is divided into 3 parts. That is the first part, so it is for the nourishing the body of the pregnant lady, and second part, so it is goes for the producing the sanya, and the third part for the nourishment of the garbha. So these are the this is like Stanyotpatti, the references will get there. So and also apart from that, even the Shushruta says that so these are present in the Sukshma Bhaga, so okay, in all over the body. So again, even before the delivery also. So that after delivery, all the dhamanis which are present in the Hridaya Sthana, it is going to open, and also that is again lactation starts after delivery. That is the Sukshma Sara Bhaga, which is present in the Sarva Sharira, enters into the breast and secreted as a breast milk. So this happens after the delivery. So this is regarding the nirmana, that is the production of the breast milk. So these are references we get regarding the nirmana aspect. And coming for the pravritti, so ejection of the breast milk, that is the Shushrutaracharya says that, so he gives the simile that is with the Shukra pravritti hetu. So that he says that Tadeva Patya Samsparsha Darshana Smaranadapi Grahanacha Sharirasya Shukravat Sampravartate. That is so Sneho Nirantara Satra Prasave Hetu Ruchyate. So again, before the delivery, there will be the absence of breast milk similar to that of Shukra. The Deva Pati Sanskar. So again, how the Shukra gets secreted by all these pleasurable feelings, that is attached sight, thought, physical contact of the lady. Similarly, Stanya gets secreted by the touch, sight, thought, and the physical contact of the baby. That is like the Sneho Nirantara Satra Prastave Heti Vijate. Sneho, that is the idea. So bonding, emotional attachment. So that things lead to the breastfeeding. That is again hetu vichate. So that will lead to the again ejection or the ejection of the breast milk. Okay, so these can be taken as a Stanya pravritti hetu. So that is again this aspect. So that is the sneha nirantara satra breastfeeding hetu vichate. That is so emotional and also the physical bonding with the child. So enhances the ejection of the breast milk. So again we get the similar aspect or the similar concept with the so even in the contemporary method also, that is the so whatever what the oxytocin reflex we got. Okay, so that is the Stanya pravritti hetu, and related references regarding the pravritti is the Sirana Hridayasthanam Nivritatva Prasutitaha Trute and Hitatuteva Srinam Stanya Pravartate. That is the so again like on the third day or the fourth day, the tree or the Prasuta tree is going to establish the sufficient breast milk, Stanya Pravartate. So till the they like so at that time all the Virat will present the Hridayasthana is going to open. Okay, so that is Stanya Pravartate references. And one more thing, and Damalina Buddhistana Vivutatva Anantaram. Chaturatra, Triratra, Bhaktina, Stanya Pravartate. So this is similar explanation. So can be seen in the Shishyatam. So again, these are the Shishyata Samhita. So this is regarding the Ayurveda aspect of Stanyotpatti. That is the production of the ejection of the Stanya. So again, coming to the contemporary view or the modern aspect. So that is the physiology of the lactation. So it's again a so before going to the physiological aspect, which is very important. So again, to know regarding some aspect of the anatomy, mammary gland, anatomy of the mammary gland. So Augustana, okay. So again, this is a this is again so mammary gland. We all know that it is a it's a modified sweat gland. And also it's again very important accessory organ of female reproductive system. Okay, so mainly we can see that we can study the mammary gland under these three headings, that is the skin, parenchyma, and the stoma. So the skin covers these all the that is it covers the gland, and also it has like features like so that is again like a nipple. That is this is a conical projection present just below the center of the breast. Okay, so it's a comparatively it's always straight so below the center of the breast, and also this is that is the nipple part. So it's a conical projection. Okay, so again one more part that is the skin head, that is the part. So that's the areola. That is the areola. So it is the present at outer margin of the nipple. So again it is a rich. It is like that areolar part is a rich in modified sebaceous gland and also the some part of the sweat gland. Okay. So again, areola period in the areola region, small project of the tubercles will be seen. That is the Montgomery. That is the so you can see this Montgomery. That is again like tubercles in the areola region. So which increases so during the pregnancy and the lactating period. Okay. So these are the so commonly physiological changes taken seen in the areolar part, that is the Montgomery tubercles or the Montgomery glands. Okay, so these are the again it's very important to know these anatomical aspects. So that is the you can see this. So whatever the this is regarding the skin aspect. So coming for the parenchyma. So these are the the parenchyma are the these are the glandular tissues. Okay, so glandular tissues. So which secretes the milk. Okay, so that's again so these glandular tissues. So that is all the glands contain 15 to 20 lobes. 20 lobes. Okay, so that each lobe contain a so that's the cluster of alveoli. You can see this. So each lobe this 15. You can see this picture. So like 15 to 20 lobes. So in each lobe we get the cluster of the alveoli. Okay, so we have the cluster of all alveoli. So again where the which is having a milk secreting cells. Okay, so in the alveolar cells. So So inner lining of the cells as having a milk secretory cells. So again, mainly the prolactin is going to act on these secretory cells for the production of milk. Okay, so the prolactin. So again you can see this particular myothelial lining above the milk secretory or the glandular tissues. So there is a myoepithelial lining will be there. So these muscle cells are going to help in a ejection. That is the where these are the muscle cells where the oxytocin is going to act during the lactation period. Okay, so these are the muscle cells and inner lining of the milk secretory cells will be there. So it's again a cluster of alveoli present in each lobe. So again, so that alveoli are drained or converged towards the nipple by draining the lactiferous ducts. These are the ducts. Okay, so these are the lactiferous ducts. So these lobes are converged or drained by lactic by the lactiferous ducts. So and converge towards the nipple. Okay, so again it is to converge or it runs towards the nipple. So each at the terminating with the nipple. So we have a near its termination, each duct has its dilatations. These are the sinuses. Okay, so these are the lactiferous sinuses. So lactiferous duct, sorry, that is the lobes, so which is containing the the cluster of alveoli. So where the production and the ejection of the milk takes place, and also these lactiferous ducts. So these are the lactiferous sinuses, and again it is going to terminate in the nipple. So again before the term it's terminated, so there is a sacs are available. There is a sinuses. So where the ejected milk is going to collect. So it's a very important to know all these anatomical aspects because so again improper latching is one of the main cause for the primary mothers and all. So again for the lactation failure. Okay, so here so it's a very important to know that whatever the lactation sinus are there, it is present in the beneath below the alveolar region. Okay, so again whenever if the child or the baby if it is towards only the projected nipple, so what happens is it is going to block the only at this part. Okay, so that is again whatever the terminatory part is there, so it is whatever the sinuses are there, it is going to complete the blockage. Okay, there is no, so that is whatever the collected the milk is there, it won't allow to eject outwards because the baby is only latching only this part, only the nipple part. So that's whenever the improper latching will be there, so then the child is not able to take the milk or the sufficient ejections or the if it is not get, so what the baby do, so vigorous cutting will start. That way we lead to the sore nipple complications. Okay, so this is one thing. So it is very important to always guide the primary mother or the lactating mother so to be put even the areolar part inside the mouth of the baby while feeding. Okay, so this is the one thing. So that is again coming for the stroma. So stroma is all the supporting framework it gives. Okay, so it includes some part of the fiber tissues and also the fatty tissues. So it gives the support for all the glandular tissues these mammary gland. Okay, so this is regarding the few anatomical aspect of the mammary gland. Okay, or the breast. So this is about the anatomical aspect, and we'll move to the. So again, regarding the physiological aspect of the breast milk, that is physiological aspect of the lactation. It includes both milk production and secretion. So again, this is the milk is produced as a result of the interaction between the hormones and reflexes. So during the pregnancy, the glandular tissue is stimulated to produce the milk due to various hormonal influences. So with regard to the milk production, the secretion, so two reflexes are mediated by two different hormones. Okay, come into play during the lactation. So that is interaction between the hormones and the reflexes will get these two pattern of the let down reflexes. That's the prolactin reflex and the oxytocin reflex. So again here we'll get these two reflexes regarding the production and the secretion of the breast milk. So coming for the prolactin reflex or the milk secretion reflex, it is also called. So again here whenever the baby sucks the breast milk, so whatever the nerve endings will be there in the nipple area, for these sensory impulses from the nipple, it sends the message to the anterior part of the pituitary gland. So there as a reflex, so it releases the prolactin in the bloodstream. So as a result of this, so it acts on a that is the secretory cells or the whatever the secretory cells of the lining will be there. So that is going to produce the milk. Okay, so this is the milk secretion reflex. Okay, so these are the enhancing factors. That is the early initiation of the breastfeed, and again as these sensory impulses, so that is again increases the release of the prolactin in the bloodstream. So with respect to that, again milk production is going to increase. So again, whenever the demand is more and milk production is being more, and whenever the early initiation of the breastfeeding, so that leads to the more production. Okay, so this is about the milk secretion reflex. Okay, that is here the prolactin is released from the anterior pituitary gland, and that is again the prolactin is released. So that helps to production of the milk in the breast. Okay, so that is again the earlier the baby is put on the breast, the sooner the reflex is initiated. So the more baby decides at the breast, the greater is the stimulus for the milk production. So the greater is the demand for the milk, larger is the milk volume of milk produced. So coming for the oxytocin reflex, so that is again a that is milk ejection reflex. Okay, so this is the same with sensory impulses, which is again caused by the baby sucking. So that sends the sensory impulses by the nipple to the posterior pituitary. So and again it releases the oxytocin in the bloodstream, and with the result of this, again there is a more ejection of the breast milk in the lactiferous ducts. So will be there, and again this is always this reflex is always associated with a emotional bonding and that physical attachment with the babies with the mother. Okay, so that is again this is the things that is again oxytocin reflex. So these are the increased or the increased factors, that is the thinking and loving of the baby, sound of the baby, sight of the baby. It increases the milk ejection. So similarly, this is again a hindering factor, that is the worry, stress, pain, doubt. So these are going to decrease the oxytocin because of non-emotional bonding between the mother and the child. So again, even our acharyas also explained that is a shoot that is a shoka krodha langhana ayasa sanyanashasya diet. That is again whatever the sanyanasha vidhana being told. So that can be, that is again it is similar to that oxytocin. So reflex. Okay. So this reflex is affected by the mother's emotion, and the relaxed, comfortable, and tension-free atmosphere helps the milk ejection reflex. And that is tense, apprehensive, worried mother or the pain and discomfort during breastfeeding hinders the milk flow. So that is again, these are the enhanced these two are become a that is the reason for enhanced milk production. That is the effective attachment and emptying of the breast during each feeding that lead to the enhanced milk production. So we need to again always keep in mind, this is also again practically it's also very important to know all these factors. So again this is a let down reflex. So that is this let down reflex is mainly intended to the oxytocin reflex. So let down this reflex is nothing but whenever the baby sits at the breast, so that is stimulation phase. And again that's stimulation. So again that may lead to the release of the hormones in the bloodstream, and that again that lead to the milk ejection reflex. That is this together, that is the production and also the milk ejection. So that is called as a let down reflex. Mainly the oxytocin reflex is concerned with this let down reflex. So it's again just remember that it may ask for the 2 marks of the in the Viva also. This is again so this is regarding the physiology of the lactation. So coming for the next important topic, that is the Stanya Sanghatana. So it's again, with respect to that, even some of the types have been mentioned in the contemporary methods. So again, depending on the composition of the human breast milk, and also it's very important to know that. So know these aspects. Hence, it is a Stanya Sanghatana. So we are going to read with the types and the composition of human breast milk. So coming for the types of the breast milk. So again, these are the types of the breast milk. That is the colostrum or the early milk. So can be taken, and transitional milk and the mature milk. So again, just remember always the types of breast milk: colostrum, transitional milk, and the mature milk. So again, coming for the colostrum. So again, it is a milk produced in the late stage of the pregnancy and till fourth day of delivery. So after the delivery. So just remember the first 4 days, whatever the milk is produced, that is called as a colostrum. So it is again it is a very ideal one for the newborn babies. So it is yellow and thick, and it contains more antibodies, having a high concentration of secretory IgA. So it contains high protein content and is the best suited for nutritional and protective needs of the baby. Hence, it should not be discarded. Okay, so it is like colostrum is a very much essential for the newborn. So again, coming for the transitional milk. So it is a milk secreted. So again, after fourth day, following the 2 weeks. Okay, so after the colostrum period, so whatever the milk secreted in the in the 2 weeks, it is called as the transitional milk. It is comparatively so having a low protein with a in comparison to the colostrum. Okay, so this is a transitional milk. And coming for the mature milk, so it follows after the transitional milk. So whatever the milk is ejected, so the produced, that is called as the mature milk. So this is a thin and watery, contains all the nutrients essential for optimal growth of the baby. So apart from that, and also we one more type of milk will be there. So that is the preterm milk. So it is a it's a wonderful adaptation. So seen in a lactating mother. That is the so that is again in the context of species specific. So which is taken in the studies class. That is a Madam has clearly mentioned that regarding the species specificity or the it is nothing but the so again milk of the mother who delivers prematurely. So we have the preterm milk. So there is again alteration in the composition. So mature milk. So that is again term delivered mother milk and preterm delivered mother milk. Okay. So that contains more calories, fat, protein, and the sodium. So again the concentration of the lactose the calories, fat, protein, and sodium in the high concentration or the contains more, and again lactose, calcium, the phosphorus are in lower concentration compared to the milk produced by the mother of the term infant. So again, this is the preterm milk, and one more different classified milk types. That is the milk which outpoured in one feeding, that can be classified as so foremilk and the hindmilk. Okay, so in each feeding, so that is in which each outpoured milk. So even in that also we have a separate sort of composed breast milk. Okay, so that is a foremilk, that is the early milk. So that is secreted at the beginning of the feeding. So it is rich in lactose, protein, vitamins, minerals, and water. And these are the these are going to satisfy the baby's thirst. Okay. So and coming for the hind milk, that is a late milk. So these are comes later towards the end of the feed. Okay. So again, it is richer in fat content and provides more energy and satisfies the baby's hunger. So again, it is very important. For optimum growth, the baby needs both fore and hind milk, and the baby should therefore be allowed to empty one breast. So before feeding for the second breast, or the second breast should offer after emptying the first. Okay, so that's whatever the nutritional factors which are present in the hind milk and the fore milk is very essential for the optimal growth of the children or the baby. So this is about the fore milk and the hind milk. So coming for the composition of the breast milk. So it is again a human milk composition is dynamic. So it is like having a wide range of specificity, and also the composition, that's whatever the constituents of it. So it is again it's a very wide range, and again so a human milk is uniquely suited to human infants in nutritional and bioactive factors that promote the survival and the healthy infants. So again, whatever the species specificity and the baby specificity, so mentioned with the importance of the breast milk. So it's mainly because depend on the composition of the breast milk itself. That is the species specificity. So milk of different animals is uniquely species specific. So that is discussed in the previous class. So that is its composition is adopted as per the needs of the body. That is again. That is cow's milk is very suitable for its stuff. So again, so that is whatever the composition will be there. That is having a high protein, and also that is again low taurine or cystine and arachidonic, like whatever the so DHA and again content in the cow's milk. So again, it is very suitable to their somatic physical growth, and also that's again so in brain growth. Okay. So whereas the human milk is as very rich in all this cysteine, taurine, and the DHA. So these are, and also the whatever the protein content will be there. So that is again so comparatively that is the whey protein, that too. So that casein and that is the alpha casein and all. So it's again very suitable for the slow somatic pattern of growing which is present in the human babies. Okay, so and also this again will have a sufficient amount of the cysteine, taurine, so and the DHL, and these few aspects. These are going to help the maturation, and also faster development, maturation, and the myelination of the brain. So which is essentially needed for the newborns. Okay, so this is a species specificity. Coming for the baby specificity, so the composition of the breast milk varies at different stages of lactation to suit the need of the baby. So again, this is what we discussed in the preterm milk, that like the same concept. So that is called the baby specificity. So that is again is very important. It is naturally so again attained the specificity, that is the baby specificity. So again these two are the benefits or the importance of the breast milk or the breastfeeding. Okay, so species specificity and the baby specificity. So this is again, so coming to the composition, so it is compared compositions being given with the cows and also with the other conventional milk and also lactose-free milk formulas. Okay, so here the energy, so again that's again almost similar. We can attain with other milk also. So coming for the protein, so whatever the sort of protein will be present, that is the weight ratio. So it is comparatively so high, that is casein will be high, and also whey. So whatever the protein will be there, so that is comparatively that is the ratios is again present in the human milk. It's very suitable. So again, in case of casein ratio, it is very high in the cow's milk. So here so especially the beta casein. So it's again curling will be more, and also that's again that particular casein is going to give a so again more tendency to get the allergens. That is again a milk allergy or the cow's milk allergy or the lactose intolerance occurs. So that is again whatever the casein proportions is there, so it is comparatively low. So it is again so that is very suitable. And also again coming for the taurine, it is a very high in human milk, whereas in other milk it is comparatively low. So and also the fat. So it's again whatever the fat, that is again so essential fatty acids. So that is again abundant in the human milk, whereas we get less in other also. So again carbohydrates, that too with respect to the lactose, so it's having very high, and also it's very easily digestible with the other enzymes present in the human milk. So it's best suited for the glucose metabolism. Okay, so that's all the what are the carbohydrates digestion. So that is again and also that's again the lactose. So that is so this is a very this is the composition related with, and also coming for the the nutrients. So human and the animal meat, that is again we have a fat. So that is again essential fatty acids which can be seen, and protein. So whatever the protein is present, it is very suitable, and also like having a so like more lactose content. Okay, so again so this is coming for the lipase. There is enzymatic action on the essential fatty acids. So contains essential fatty acids and also having a enzyme lipase. So it will become very digest for the this particular breast milk by the baby, and it's again having a non-essential fatty acids, and it's like it is absence of lipase. So it is again very so difficult to digest by the baby, and also it's coming for the protein. Again, it's whatever the whey protein is there and whatever the casein is there. So it is again in a proportion. So it's easy for digestion. So like here is the casein. So it's difficult to digest as the curdling will be more happening with that. So it may irritate the child intestine. That's like coming for the vitamins in the in the different milk. So the vitamin C is very rich, and vitamin A and vitamin D also is again are present. So again, the coming for the iron in the milk, so it is having a more transferring, and whatever the factors are there, so these are going to act as a bacteriostatic action, that is whatever the so again iron utilizing bacteria factors is going to so hinder it. Okay, so that's again whatever the iron content it is there get prevented in the milk, and also coming for the cysteine, taurine. These are the factors which promote the faster development, that's the maturation, myelination of the brain, and the presence of these factors, that is the epidermal growth factors and peptides, enhance the physical growth. So these are the few important aspects of the composition of the breast milk. So apart from that, even the immunological factors, that is it is having a wide range of immunoglobulins, that is IgA, IgG, and IgM. That is technically IgA is a very abundantly seen, and also cellular elements, that is the lymphoid tissue cells. So again, T and B lymphocytes and polymorphs, and like the granulocytes like similar content, and macrophages, and also lysozymes, and lactoferrin and the transferrin. So again, these are going to bind the iron content in the breast milk, and oligosaccharide. Again, PABA, that is the para-amino benzoic acid. It protects against the malaria, like in the infection in the baby. And whatever the bifidus factors are there, it helps to grow the healthy bacteria, that is the lactobacillus bifidus. So in time, again having a it prevents from the recurrent diarrhea to the baby. I'm coming for the specific inhibitors, that is antiviral and anti-streptococcal factors are going to play a role in a baby with the breast milk. Okay, so these are the immunological factors in the summary. Will have a anti-infective factors and growth factors and protein at the correct amount, and whatever the easy for digest, and that is present in the human milk, and whatever the fat is there, enough essential fatty acids. So that is again with the lipase will get to digest that particular fat, and iron. So small amount well absorbed, even though it is present in the small, it is well absorbed by the baby, and also it's having enough vitamins, and also the enough water content also compared to the other formulas or the animal milk. Okay? So these are the few aspects of the composition of the breast milk. Coming for the advantages of the breast milk. So it's again by the breast milk, we will have a various level of the benefits. That is the benefits to the baby, to the mother, and benefits to the family and the society. So again, under the benefits to the baby, so again by this a natural breast milk, so we'll have it is a complete food, and we know that species specific, and easily digested and well absorbed, and protects against infection and promotes emotional bonding and better brain growth attains to the baby. And also coming to the mother, so it helps in the involution of the uterus. That is again due to oxytocin. So it is again attained to helps to attain the like the pregnancy status of the uterus, and also delays the pregnancy as it becomes this prolactin. So it's going to abundantly released in the lactation period. That is going to cessate the ovulation. That is again leads to the delayed pregnancy and acts as a natural contraception. And also that lowers the risk of breast and the ovarian cancer in the mother, and also it decreases mother's workload compared to the any other artificial milk. So with the aspect of handling the utensils and preparing the formula, so for feeding the aspects and all. Okay, so this is the benefits to the mother. So again, benefits to the family and the society. It saves the money thing and promotes the family planning, and also decreases the need for the hospitalization. So again, we all know that this again, so whatever the immunoglobulins are there, or the again all the antiviral or the anti. So these are again due to that breast milk. So the baby attains the non-infective stages. So again, that promotes the health for the child, and that leads to the so again less like visit to the hospital. Okay, so that is a decreased need for the hospitalization and contributes to the child survival. Again, the so again these are the composition of the breast milk. And coming for the last topic, there is a specific feeding schedule as per Ayurveda and the modern aspect. So like feeding schedule, the specific whatever the guidelines. So we'll get a few the guidelines in our classes. That is the so when to start nursing, and that is again breast milk, breastfeeding, and with respect to the when not to start breastfeeding. So we'll have a few references. Okay, so that's again apart from that, what we can so consider a few aspects regarding the feeding schedule. So is again a so in the Jatamata Sanskara, Ayurveda, so again in the Acharya advises the breastfeeding immediately after birth, which is mentioned in the Jatamata Sanskara. So that can be taken as a guideline for the breastfeeding. Okay, so this is again breastfeeding. And apart from that, again feeding schedule for again a 4 days regimen has been mentioned for the Prashnartha. So again, apart from that, even that we have a reference regarding the Morata and the Piyusha. That is a so it is nothing but the cholesterol. So similar explanation will get that is in the Dalhana. He explains that Moratam Gornare Chire, the Sudi Dinam Arabhyam, Saptahat Parato Yavat, Prasannatam Na Gachati, Tavan Morata, Iti Uchate. That is called as a Morata. So Moratam Gornare Chire, it is the heavy nature. The Sudi Dinam Arabhyam, that is like this. So that is day one of the Prasuti, that is again so for Prasuta Dina. And Saptahat Parato Yavat, and after some time, so whatever the milk expressed, so that is called as a Morata, and Yavat Prasannatam Na Gachati. So again it is a so it's a different view of regarding the cholesterol or the given. And also that is again we have one more reference, that is a Kshiram Satya Prasutaya Pinsha Iti. So that is again even in some of the references say that it is a the Piyusha is a so whatever the Morata is a Sapakaraka, and also it's a Gaurava Gunayukta, and it is not suitable for the child stage. So but it's again it's clear that in the contemporary research again it is proven that the colostrum is very ideal food for the baby that can be followed. So anyhow, so we have the reference to the Jatamata. Apart from these, while explaining the Morata and the Piyusha, so nowhere they explain the contraindications in the breast milk or the Piyusha in any instances. Okay, so only that aspect. So we cannot take it as a thing, and it's again clear that the colostrum is a very good for the newborn that can be followed. Okay, so coming for the when not to nurse or the when not to breastfeed, so that is we can take it as a contraindication. So that is the feeding schedule. So that is the Nacha Shrita Shokarta Shranta Krutta Pradushta Dhatu, Garbini Jvarita, Atikshina, Atistula, Vidagda Bhakshya, Virudha Ahara, Taitayaha, Panyam Paye, Na cha Jeerdaushada, cha Balam, Doshoshada, Doshoshada Malanam, Tivra Vegotpatti Bhaya. That is a, so it's again, they like gives the guidelines for the not to feed in such instances. That is the nature. So should not go for the nurse in the Shurita. So hunger, Shoka, Shanta, Kruda. So these are the so disturbances that like lactating mother had, and also Pradusha Dhatu and Garbini, the lactating mother is become Garbina Avastha, that is not to feed. And Jvarita, Atikshina Avastha, Atistula, Vidakta Vaksha, the mother had the baby image, and also Virudha Ahara, and also that's should not go for it. And na Ajirna Aushadha. So it's again, if the medicine if it is taken, so if it is not digested in such instances, should not go for the nursing. Na Ajirna Aushadham cha Palam. So that lead to the dosha Aushadha Mananam, Dira Vegotpatti Bhaya. That is that lead to the, so that again various dosha prakopa even in the child, and again that may lead to the diseased condition. So these can be taken as a contraindication for the breastfeeding. So as for the modern aspect, so again there is a few feeding specific feeding schedule has been mentioned. So it is very important to follow each and every one. So again, with respect to feeding application of the while advising the any lactating mother. Okay. So baby should be put on the breast as soon as mother has recovered from the labor. That is preferably within half an hour in normal delivery. Okay. So again, as early as possible, we need to put on breast milk. That is again within half an hour, or within 2 to 3 hours in cesarean section, or after stabilizing the mother and the baby, you can go for it. Okay. So within 2 to 3 hours in stage of cesarean section. So this is the foremost important. So that is again early putting on breast, and also should offer on a semi-demand schedule in the initial weeks. Okay, so that is fed on every 2 to 3 hours. That is a semi-demand schedule initially. So post immediately after birth, so that child is went with a deep sleep, and also in such instances we should not allow the baby to sleep. So as it as a bottom is inside. So that's in that like semi-demand schedule, and also usually in the initial weeks of the post-delivered period. So that is again a semi-demand schedule. That too, So again, it's initial 8 to 12 weeks. So we should follow the semi-demand schedule. That is so must and should. So on every 2 to 3 hours, the baby has to fed. So later on can follow the on-demand schedule, so that the baby. So till that the baby will be so this is again trained for that particular hunger feeling and all. That's again become a, so that baby can able to demand for their feeds. So that's again later on can follow the on-demand schedule. That is after 8 to 12 weeks you can go for the on-demand schedule. So usually preferably for the 4 to 6 hours you can go for. So apart from that, exclusive breastfeeding. So apart from these factors, so we also can very important to follow all these schedules. That is the exclusive breastfeeding for the 6 months. That is the exclusive breastfeeding is the only the breast milk. There is no need, even water is needed for during the first 6 months. Okay, so this is very important. Even the WHO gives the guidelines for the, so all the BFHI centers and all the, so others other even in the health workers to go for the exclusive breastfeeding for the 6 months. Okay, so that is again. So after that, complementary feed can introduce. So that's again coming for the predominant breastfeeding. So here there's some sort of changes can be seen after, can be followed after the 6 months. Okay, that is the predominant breastfeeding. That is here the, so the breastfeeding, the breast milk itself is the main feeding here in the during this period, and also along with that other milk also can be given, and also with the other fruit juices, some sort of fluid drink intervals can go for it. Predominant breastfeeding. Here the feeding or the breast milk will be a major feeding. Okay, so along with that, other milk or other liquids also can be given. That is a predominant breastfeeding. So coming for the partial breastfeeding, so this can be continued till 2 years. After the 6 months, till 2 years can be go for it. So that is a partial breastfeeding. That is a partial breastfeeding is a, so again like usually the child is again after starting with the weaning or the existing with the complementary feed. So as it is like a baby needs all these solid foods are intended to their nutritive wants, and these are going to partial breastfeeding. So that can be continued till 2 years. That is nothing but the, so one can feed the child till the 2 years or usually that the WHO gives the guidelines. So when at what time the mother can feed, that mother can feed their children. Okay, so that's especially the till 2 years can be followed. So these are the specific feeding schedule. So in the modern aspect. So along with that, this schedule, so we need to follow some of the rules of the while breastfeeding. Okay, that is the rules of the breastfeeding. So it is a very to follow these rules. So again, helps in a proper lactation, and also this again proper nourishment of the baby or the child will attain, and also it is again intended. So it helps to attain the this stage for the children. That is again a mother and infant should sleep in proximity. That is the one thing, and also after each feed that we need to, and at every feeding the infant is placed only on one breast, and then during the next feeding on the other one. So thus alternating them. That is very important. We need to follow that. And the duration of feeding is about 20 to 30 minutes in an average. It can be taken, and we cannot say that it is a actual in the at one feeding we cannot follow this. Some child may take 20 minutes, and some baby may take for the more than 30 minutes. That is the important. This is the minimum. On an average, you can take it. So it's again with a tension free and with a relaxed method. So that that again the feeding should be done. That is the for the 20 to 30 minutes of time. So again, next is give no supplement. There is to breastfeeding newborn infant. There is no need of any sort of supplement is needed, and also to follow the indicators of good attachment and positioning. That too. So like the latching of the breast, now the latching of the nipple. That we need to. So whatever the discussed in the last class by the Dr. Radhika madam, that can be followed. That is so like the lower areolar part is more put in the inside the mouth of the baby, and also that the lower lip will be outwarded, and also that's synchronizing the biorhythm of the rooting and setting reflex. We call the seen in a child, and that sort of that some sort of indicator of good attachment and positioning is very much needed. And with respect to that, you know, follow the indicators of successful feeding in the babies and the mother. That is the so that both the mother and child should sleep in proximity. So after feeding, and with with respect to the babies, so having a passage of urine that is 8 to 10 times per day, and also that again immediately after feeding, that's again sufficient good sleep. So that again like the proper growth, like weight gaining, and again these are some of the successful feeding indicators. So with respect to the mother, and feeling lightness in the breast after feed, and also the good sleep, and also that these are the with respect to the mother. Okay, so these follow the indicators of successful feeding in the babies and the mother. So these are the some rules of breastfeeding to be followed for the proper lactation or the successful lactation. So this is regarding the few aspects of the Stanya. So this completes. That is again one more thing. So it's a very one more aspect, that is the contraindications of the breast milk. So again, in fact, so the galactosemia, where the that is again so glucose is not able to again metabolize. So that is again galactosemia. So it's again intense contraindication. So in such cases, you should not go for the breast milk. Apart from that, so in the mother, so mothers infected with HIV, this is again the questionnaire. So again now here, so there is no evidence of that passage with the, so whatever the again virus through the breast milk, again it is again if it is carrier in the mother, carrier mother, we cannot predict that. So it's again like better to avoid. Why means, so that is again if the mother is having any sore nipple or the cracked nipple, and with that if the child is having any ulceration or the optic ulcer or the any sort of infection, so that may transfer this particular virus. Okay, so if it's that, so it's again usually the HIV positive mothers, so go for the contraindication. And also mothers taking any of the following medications, that is the radioactive isotopes, cancer chemotherapies, and agents like antimetabolites or the other drugs. So these are going to, so again consider as the contraindications of the breastfeeding. Okay, so this is about regarding the and these are the few expected questions. So regarding this topic, that is like in the previous in the previous exam, so we got this particular question for the long essay, that is data. So write the importance of the Matru Stanya and children. That is again, so you people need to, the students are need to write all the, again whatever we discussed in the introductory part, that we need to write. And again importance of Matru Stanya. So with respect to the composition, and also whatever the again advantages with respect to the baby, mother, and for the family, that we need to explain in detail. And also the importance of Matru Stanya. So whatever the simile has been explained, that we need to quote according to Ayurveda. So it is as it is long essay, so you need to like cover all those things. Okay. So again, I want to add one thing to the like in general, whatever like while attending in the class, so for in the exam. So for the long essay, always try to put the introductory part of that related question, and also go for the description, and always again depending upon your like whatever the answers given. So try to give like a short conclusory part. That is again what is the like, so that what the importance of that particular topic. Okay, so that is again so it attracts the like whatever the like evaluators. That is again the team presentation should be there for the long in the so answers in the like answer sheet. Okay, so that's again important aspect regarding the so attending the question paper. That's the long essay. And short essays, that's again this is a very important Stanya concept. Is again very important aspect. We have these are the previous questions. That is the Stanya Sampat Lakshana. Again, Stanyotpatti. So you need to write depending on the question. You need to write that is again. So again, Stanyotpatti detail the Ayurveda aspects and try to bahad the shlokas. And again, that's 2 reflexes in short. That's again depending upon the marks you need to go for it. Okay, so Stanyotpatti. And coming for the Stanya Sanghatana, we have a like enough like stuff for the write the composition of the breast milk. So it's again like in the previous question paper we got this question, and advantages of the breast milk, which is also we have a like all the we can write enough for the 5 marks. Okay, so for coming for the short answer, these are the questions. That is the types of breast milk can ask, and colostrum, that is the Piyush or the Morata can ask, and also Stanya Sampat in the like 2 or 3 years back. So they ask for the 2 marks. Okay, so these are the some of the like questions asked in the previous question paper, and also expected questions. Okay, so again with that, so it's the time to conclude today's session. That is the class. So thank you all for listening me. Thank you, ma'am. Okay, so thank you.
Thank you, madam, for your nice presentation and very detailed presentation with the pictures and all. I think all the students, they got the topic understanding. They understand very well. There is one question in YouTube, ma'am. According to Ayurveda, in insufficiency of breast milk, Ajadugdha or Godugdha are told, but nowadays milk formulas are advised. Which one among them is better?
So once again, what's the question?
Ma'am, in absence of breast milk, Ajadugdha and Godugdha are mentioned. nowadays the formulated milks are used. Which one is better?
So better to go with the formulated feed itself, because here the so that's again if at all it is not available, then you can go for the formula feed, which you can go on cow's milk and because whatever the lactose and whatever the protein will be there, it is accordingly it is planned and it is prepared. Okay, so it's compared to that again now anyhow it is available, so better to go for the formula feed. Okay, so especially in the newborns. So in the newborns, better to go for the formula beach itself. So after 6 months, you can go for the other feed. Okay. So I think it is clear. The question.
Thank you, ma'am.
Uh,
Other participants, if have any doubts or anybody from the participant want to add to the session, they can. Madam, Ayurvedic references for Stanya Sanghatana.
so Stanya Sanghatana, I can that is again whatever the Rasa Guna, Veer, Paka that you can take it.
Repeat, ma'am.
Huh?
Inansari heli, ma'am.
So Stanya Sanghatana, that is again whatever the Prakrita, Varna, Gandha, Rasa, so that can be taken. Okay, and also that's again in the different treatment that can be taken. That is Rasa Guna, Veer, Paka.
As like modern, we don't have the nutrient values in the Ayurveda, but we mainly prefer on the Karmukata, not the nutrient. So that Karmukata can be taken as a Sangatana, Sanya Sangatana. Main thing here I want to add is that is the Kashyapa's shloka, Avyahata Balanga Ayurvardate Sukham. If that is there, then definitely that milk is the best milk as considered.
Okay, that's what again.
It has all the nutrient required for the child.
So with respect to the both mother and the child, its effect has been mentioned. That's the ideal one.
Yes. Madam, one more question. COVID-19 and breastfeeding, please explain.
Okay, this is a very good question. So now, like presently, we are facing with that crisis. So it's again regarding the transformation or the whatever the that virus is into the breast milk. So it is not sure. Okay, so that's again it is not reported also. That is again they say that it is not. So as it is droplet infection, and also it's a very whatever the so immunoglobulins in the mother is sufficient to that's again phagocytic thing. So anyhow, that's again the active COVID and positive mother. So only the thing is while feeding, we need to take care the some of the aspects. That is the to protect that whatever the droplets are there, so it's not allow the to reach the baby. So again, while feeding, you can follow some of the aspects. Otherwise, you can go for the breastfeeding. Okay, so that's as such, there is no contraindication during the COVID-19 positive mother. So that is again, you can go for the feeding with all the precautionaries. That's the prerequisite. That is again. So during the lactation, always again. So that is put the mask by the mother, putting the mask by the mother, and also that's again to avoid the touching of all the nose and the mouth part, and also that's again and before and after before feeding, and always hygienic regarding the hygiene of the hands, the sanitization has to be done. So that sort of methodology can be adopted. So apart from that, so can go for the feed.
Okay, madam. One more question, that if Stanya is not produced in sufficient quantity, what should be done? I think it is dealt in yesterday, or in future it is there, ma'am. Stanya Vardhanopayas. Yesterday also it is told. In
We
future,
have
I
a
think once
method,
again.
Stanya Vardhana that is again it's a very effective also. So again, in the other system of medicine, they have a very few. So even they don't have any such medications. That's the gynecological medication. In that view, so we have very good Stanya dravyas, and also it's a very effective. So we all been using in our practices. So it's a very good result that can be followed. And again, here again the emotional status of the mother has to be assessed. And again, that's again lactating. That's again proper latching of the breast milk. That's the proper way it has to be excused. That things to be seen. So most of the
Okay.
time, again, even diet and also emotional factors nowadays.
One more question in YouTube, ma'am. During insufficiency of mother milk, cow milk is advised, but as you told, cow milk is difficult to digest and iron content is also less. So explain on that, ma'am.
So here the that is so that's again human milk contains less in iron, of course, compared to that cow's milk. So that is again coming for the like whatever the protein is there. Sorry, coming for the iron. So that is again whatever the content is there in the like, so it is present abundantly present. So that is again lactoferrin and transferrin. So these two factors are going to bind this particular iron and also zinc and the magnesium in the breast milk it is presenting. And also it's again these factors transferrin and these are going to act as a like bacteriostatic action on the iron feeding bacteria. Okay, so that's again another. That's the one thing. And also coming for the protein. So of course it is also that the cow's milk also having a that's a whey protein and also casein. The proportion is different. So with that, so again whatever the like casein is there, and again that is again whatever the that the protein is there, that is also that have the lactoalbumin and the lactoferrin in the human milk. Whereas in the cow's milk, we have the lactoglobulin sort of protein. So it's again very much hard to digest from the child. So that is again it may like most most of the baby will get the so that particular protein milk protein allergy, and also it's again very hard for the digest and also may have the episodes of the either constipation or the diarrhea behind. Okay, that
After the delivery also, mothers does not get the milk. Then what are the drugs can give and what procedures can do?
so after the delivery.
After the delivery, mothers does not get the milk. Then what are the drugs can give and what procedures can do? I think they want for a baby or mother. I'm not understanding. Vinayak Kulkarni.
So here, like immediately after birth, so anyhow, so even that is again for first initial days, that is 2 to 3 days. So again, sufficient milk production will not be there. In such instances, so again in the newborns, that whatever the colostrum will be there, so that is that's what I'm saying. That is early to breast, early to production. So that's again we need to promote the child, promote the mother to put more and more, even though if it is not like presence of milk production, so that the presence of milk, so that we need to give the or the mention the importance of regarding the so breastfeeding or the putting on the breast. That's the one thing. Apart from that, again some sort of aharas we can advise. Again, that is all the madura aharas. Apart from that, Stanya dravyas can go for it. And again, we need to mention regarding some proper latching method and also all these things for the especially for the for the child is the newborn. It's not in the term baby. It's okay. So you can go for the initially. So it's again if it is not at all production is not there, then we can go for the short term. We can go for the formula feed. So if the child is getting a dehydrating, and the child is not getting a child is inactive, then go in such instances, then only you can go for the formula feed for the short term. That is for the 2 3 days along with the repeated putting on breast. Okay, that is very important because this artificial feeding or the top feed are going to hinder this particular are going to save this particular lactation. So it's a very important to put on breast. That along with that in some instances you can go for the formula feed. So that in that one instance, if it is preterm or if it is extremely low birth weight or the low birth weight, where the so there is more chances of getting a like hyperbilirubinemia and all. So it's again it's depending upon the instances. That is, if it is severely or the extremely low birth weight, you can go for the IV fluids, or otherwise the low birth weight where the baby is not able to extract the breast or the suck the baby, like even though having more than 1,500 grams weight and all. So that usually that's above 1,800 gram or the 2,000 gram. So baby we usually will cut the breast. So if it is not sucking, so if the baby is not sucking, then we can go for the that is expressed breast milk, one method. That is again a technique, can go for it. Or otherwise gavage feeding in the severe or the extremely low birth weight babies. And also one that is a paladai, that is again with a so that feeding, that is again spoon feed instead of spoon, paladai feeding, that can be go for it. Okay, so that is again expressed milk, breast milk method, we can go for it. Or otherwise initially that is again in the some instances IV fluids can go for it. And again treat the like the situations, that is again the so if it is any septicemia, then that along with that, with respect to feeding, this can be followed. I think it is clear. Okay. So
Okay,
it
ma'am.
is Stanyavardaka Dravyas can go for it.
One more question, HIV and breastfeeding.
Ah.
If mother is positive of HIV, then whether
So in the
breastfeeding
first,
can
that's what that's usually so the in the contemporary science what they guide, what the guide is. So there is no need to contraindicate the breast milk until and unless. So that's again that both if the mother is carrier, then okay, that is again can be given. But so there is a chances of getting a so that is HIV infection to the child is again so there is like having a more instances. So because of sore nipple along with the after sulfurs or the that is again with the like the mouth ulcers or the stomatitis like condition where the wound opening will be seen in the child. So in such instances there is a so chances of transforming these viruses. Hence better to contraindicate in the HIV. So again it is a depending on their uh, condition or the status of the mother, if they can, it can go for it. Otherwise, it is a hence like it is a query. So it can be not.
according to the modern, only 5% of the HIV will transfer from the mother to baby through the
Maybe.
breastfeeding.
That's
The
that's what exactly.
chances is only 5%, and
Ah,
most of the time the choices will be giving on to the mother whether she want to wish to the feed the baby or not, and it is well planned elective LSCS and all, then definitely we can contraindicate it. Otherwise, if labor and is not planned, then breastfeeding is considered as not contraindicated. Again, it's a controversial issues. And one more question in the YouTube, ma'am. If mother is COVID-19 positive, the medicines given for the COVID-19 positive, whether they transfer in the breast milk or not, whether they harmful for the baby, breastfed baby.
it is not so actually. That is again in the only again in the simple medication or with the so acute illness you can go for the breastfeeding. It is not so that is again so when some of the uh, like uh, uh, like the anti-cancerous drugs, so chemotherapies, that is again strong having a the mother itself is not able to have hold those effects. So it's better to COVID-19 medications. It is no problem. You can go for it. It
Okay, ma'am.
doesn't any transfer into the lymph.
Thank you. One more question, madam. Does the medicine used to cure COVID-19 pass to breastfed babies? Madam has answered no. Medicines will not transfer. Infection either by, again, the droplet through.
It is
Infection may
again
pass.
medication will not affect the child's.
Okay, madam. No questions. I think all the questions are cleared. And this breastfeeding topic is again continuing for 2-3 days. So whole topic of breastfeeding is divided for 6-7 days. If any short points are left, that will be covered in future. And today's madam has covered very nice, and Madam has presented it in very nice way also. Enlightened. I enjoyed a lot, and I hope the students also enjoyed a lot. Thank
So
you, ma'am.
thank you, Pratigna auntie. So it's again, once again, I'm very happy to share with you all these factors with you people. And again, thank you, Ananda. Okay,
Thank you, ma'am. Thank you.
okay. So
And
hope it is it was useful for you, for the audience. Thank
thank you.
you.
Thank you, ma'am. So bye bye everyone. Tomorrow also at same time. Once again we will meet tomorrow, even though it is Sunday, but we will have the meeting at 3 p.m. So please be online. Thank you. Thank you one and all. So I'm going to end the session.